Hello everyone, welcome to Let's Medicine. So today the topic of discussion is gastroesophageal reflux disease. What is basically the gastroesophageal reflux disease? It's the inappropriate relaxation of the lower esophageal sphincter that results in the acid content of the stomach to comes up into the esophagus. The symptoms of gastroesophageal reflux disease are worsened by the intake of nicotine, alcohol, caffeine, chocolate, peppermint, and the late night meals, while obesity is also one of the causes. The symptoms of gastroesophageal reflux disease is the patient will come with epigastric burning pain that will radiate up into the chest, while some patient may complain of sore throat, bad taste, hoarseness, and cough also. Diagnosis: the patients are often diagnosed on the basis of their history, while the most accurate test is the 24-hour pH monitoring. Endoscopy is also an option and it is indicated when there is signs of obstruction such as dysphagia or adynophagia, when there is weight loss, anemia or heme positive stools, and the symptoms more than 5 to 10 years to exclude the Barrett esophagus. The symptoms of gastroesophageal reflux disease may also show redness, erosions, ulcerations, strictures, or Barrett esophagus on endoscopy. Treatment: for the treatment, all patients should first of all avoid all those factors that basically caused it or exaggerated it. So that includes losing weight if obese, avoid alcohol use, nicotine use, caffeine, chocolates, and peppermints, avoid eating at night before sleep, and elevate head of the bed 6 to 8 inches. The medical treatment depends upon the severity of symptoms. So, if the symptoms are mild or intermittent, then the patient is given liquid antacids or H2 blockers like famotidine, ranitidine, cimetidine, etc. If the patient is having persistent symptoms or the erosive esophagitis, then the PPIs are suggested. And if the patient is not responsive to the medical therapy, then we go for the surgical or anatomical correction, that is a Nissen fundoplication, endocinch, and the local heat and radiation of the lower esophageal sphincter. Nissen fundoplication is the wrapping of the stomach around the lower esophageal sphincter. Endocinch is a technique to place a suture around the lower esophageal sphincter using a scope, while it can also be treated with the local heat and radiation of the lower esophageal sphincter, but it can cause scarring. Well, that was all about the gastroesophageal reflux disease. Thank you for watching and meet you in another video.